Choice Arrangement Act, a package of bills designed to give working Americans and small businesses more options when it comes to health coverage. Over half of Americans receive health coverage through employment-based insurance plans. While large employers have the resources to readily provide benefits, small businesses all too often cannot afford to do so. This burdens both employers and employees at mom and pop and Main Street businesses. Unaffordable health costs, limited options, and administrative burdens create barriers. This disadvantage makes it even harder to attract and retain a talented workforce. H.R. 3799 will address this dynamic. By allowing small businesses to band together and offer pooled health insurance coverage to employees, it will deliver more choice and flexibility. It also takes steps to reduce costs for small businesses that choose to self-insure, and will codify choice arrangement plans to allow employees to provide tax-advantaged funds to employees to purchase portable health insurance plans. H.R. 3799 will go a long way toward reducing insurance costs for employers, ensuring that workers continue to have access to high-quality, affordable health care coverage through their workplace. The second measure I'll discuss is H.R. 3564, the Middle Class Borrower Protection Act of 2023. The Biden administration has been outspoken in its desire to re-engineer every aspect of America to fit a progressive agenda. A massive expansion of spending and the size of government has only been a starting point of that design. We've also seen them force their agenda through executive mandates. Many of these regulations have impacted wide swaths of our economy and daily lives. They even include policies aimed at hampering the one-of-a-kind ladder of opportunity and upward mobility that fueled the promise of the American dream for generations. It's for that very reason the Rules Committee is here today considering H.R. 3564. Home ownership is a goal for many. People work hard, save, and live within their means in pursuit of purchasing a home. Yet the Biden administration wants to punish those who've prioritized financial responsibility. That's right, the Biden administration supports a new rule that would raise mortgage fees on borrowers with higher credit scores, while borrowers with lower scores pay less. So if you've worked diligently and managed your credit, you'll now pay more to subsidize those with riskier loans. It's deliberately unfair. It's also a significant new tax on 1 out of every 2 borrowers. H.R. 3564 will block these unjust mortgage fee charges from ever being implemented. Finally, our third measure is House Resolution 461. Last month, New York City shocked many Americans when it announced its plan to house migrants in public school facilities. You heard me correctly. New York tried to take public school facilities away from school children in order to use them to house migrants. While New York City backed down on this deeply misguided plan, other major cities have considered doing the same thing. It's indisputable that the United States presently faces a crisis at our southern border. This is a national security and humanitarian crisis, and unfortunately, it's largely of the Biden administration's own making. But the many failures of their radical agenda do not excuse local governments like that of New York City deciding to prioritize migrants over school children. House Resolution 461 expresses congressional condemnation of New York City's proposed plan and makes clear that this should not happen anywhere in America. It also articulates that the ultimate fault for this crisis rests with President Biden, who has systematically failed to secure the southern border and who has made it drastically harder for the federal government to address illegal immigration. I now yield to our ranking member and my very good friend, Mr. McGovern, for any remarks he wishes to make.
Well, thank you, Mr. Chairman. And before I begin, I want to acknowledge the presence of some guests: Anastasia Glover, Jalen Batista, Emily Dickey, and Kevin Trout, all part of the SUNY system in New York. And the reason why I'm acknowledging them, even though I'm from Massachusetts, is that our staff director on the minority side, Don Sisson, is a graduate of the SUNY system. And so we want to welcome them all here today. And it's good to see you, Mr. Chairman. We are here to consider three measures, none of which help the American people, all of which are about advancing House Republicans' extreme agenda. Res 461 is inflammatory, uninformed policy that would condemn using school gyms as temporary places of shelter for migrants. Frankly, this non-binding resolution doesn't solve any legitimate problem. Instead, it demonizes migrants, including asylum seekers who are here legally. Let's dig into that a little bit more. The way this bill is written, it could include asylum seekers, people who have fled their country because they have an individualized fear of persecution. Many of them have been traumatized in ways that none of us here can even imagine, and yet Republicans don't seem to care. They want to use them to make a point. And I can't believe I have to say this, but these are people, not political pawns. They are coming to our country seeking a better life. They are human beings and deserve to be treated with dignity and respect. And yet, Republican governors have treated them like they are garbage, busing them across the country with no advance notice or coordination to score political points. And I find that disgusting. If these were victims of a natural disaster, a fire, flooding, a building collapse, we wouldn't hesitate to provide temporary shelter in school gyms and other available public facilities. So really, this legislation comes down to the fact that Republicans would rather demonize people than do something to help them. And Republicans are selling this resolution as an important measure to, quote, protect students. Seriously? Let's talk about protecting students. Our kids are dying from gun violence. We have lost nearly 1,000 kids so far this year to guns. Parents are terrified that their kids will be next. Teachers are terrified their class will be next. Students are terrified that they or their friends will be next. And Republicans want to regulate gyms. It's not gyms that are killing our kids, it's guns. If Republicans were serious about helping students, they would do everything in their power to end the gun violence epidemic in this country. They would work to address learning loss. They would provide adequate school funding so class sizes could shrink and teachers could get paid what they deserve. These are issues that parents, teachers, and students are begging Congress to fix. And unfortunately, it doesn't seem to matter. Republicans are saying no to increasing school funding, no to keeping our communities safe, and no to improving our education system. But they are throwing their full support behind passing this resolution that does nothing to help set students up for success and only furthers culture wars by disparaging and attacking migrants. It's disgraceful. Then we have Republicans' H.R. 3564, which would increase mortgage fees charged to middle-income borrowers but decrease fees charged to wealthy borrowers. You heard that right. They want to make it harder for middle-class Americans to purchase a home. And then we have H.R. 3799, is House Republicans' latest bid to chip away at the Affordable Care Act, undermining the health care of millions while playing into the hands of big pharma and billionaire health insurance companies. The ACA is popular for a reason. It expanded Medicaid for low-income Americans, protected access to coverage for people with pre-existing conditions, required private health insurance to cover preventive care without any cost sharing, and created state-based exchanges where individuals can purchase quality, affordable coverage. This bill would circumvent the ACA's protections on pre-existing conditions, lifetime and annual limits, and preventative care, potentially jeopardizing millions of Americans' health coverage. Both bills make one thing clear. Republicans have no shame in ensuring big corporations and those with means get even further ahead while making it more difficult for regular people. Meanwhile, President Biden and Democrats are working to expand the middle class to build a strong economy from the bottom up and the middle out. Inflation is slowing, and unemployment rates are at historic lows because of the policies that Democrats have enacted last Congress. Republicans want more tax cuts for the ultra-wealthy and well-connected, while they slash essential programs and funding that helps everyday people. So Democrats want to protect vulnerable Americans and make the economy work for everyone, and it's as simple as that. And with that, Mr. Chairman, I yield back my time and look forward to hearing from our witnesses.
Thank you very much. Before I turn to our witnesses, the chair wants to exercise a personal prerogative and recognize my friend, Mark Tapscott, who's in the back. Mark and I were teenage Republicans together in our high school in Moore, Oklahoma, longer ago than either of us care to admit. I'll acknowledge I was older than him. Not much, 1 year. But my friend later went on, had a distinguished career, was communications director at the Republican National Committee, has been with a variety of conservative publications since then, including most recently and still with Epoch Times, which if you're a conservative, you know quite well, and the mastermind is back there behind you. So, Mark, it is really good to see you and delight to have you here. Thank you, my friend. Without objection, any prepared statements that our witnesses may have will be included in the record. I'd like to welcome our first panel, Chairman Jason Smith from the Committee on Ways and Means, and Chairwoman Virginia Fox, and Ranking Member Bobby Scott of the Committee on Education and Workforce. Chairman Smith, welcome back to the Rules Committee, and I welcome your testimony.
Thank you, Chairman Cole, Ranking Member McGovern, for having me here today. It's always a pleasure to be before the Rules Committee. As we learned this week with the latest Consumer Price Index report, working families that have spent the last 2 years being hammered by inflation, they continue to suffer under higher prices. At the start of Joe Biden's presidency, the Congressional Budget Office projected the economy would recover to pre-pandemic levels without any more stimulus. Then Democrats proceeded to ram through trillions in new spending that led to the highest inflation in 40 years, making everything from food to gas to health care less affordable. What the president's cost of living crisis has taught us is that too often Washington gets in the way of Americans being able to provide for their families. And when Washington needs to be involved, it should be a partner with the American people, not a barrier. The Ways and Means Committee has traveled over 5,000 miles from Atlanta to the plains of Oklahoma, where we've heard from workers and small businesses about their difficulty in today's economy. The very first healthcare hearing our committee had was specifically focused on identifying the drivers of high healthcare costs and to hear from small business owners and policy experts what Congress can do to expand choice, increase flexibility, and reduce burdens. I'm here to discuss policies that recently passed out of the Ways and Means Committee that will do just that. Health reimbursement arrangements, HRAs, allow employers to provide tax advantage funds for their workers to cover qualified medical expenses. In 2019, President Trump expanded HRAs to let workers use those funds to purchase their own health insurance plan on the individual market. Representative Kevin Hern's bill, the Choice Arrangement Act, would make this flexible option permanent under the law for small businesses and workers. We've heard that 87% of small businesses say they want another way to provide health insurance for their employees without offering a traditional group plan. And 90% of individuals want to be able to take their health insurance with them if they change jobs. The Choice Arrangement Act allows for just that. Through this bill, mom and pop shops on Main Street have the option to avoid managing a complex health insurance plan and instead spend their time focusing on their workers and customers. And for workers, it means that they have more flexibility and options when it comes to choosing the right health plan that works for them and their families. And as important, they can take their plan with them if they change jobs. Also contained in the Choice Arrangement Act is a solution authored by Representative Claudia Tenney. During our hearings, we learned that only 30% of small businesses with less than 50 employees offer health insurance. That's down from 50% only 20 years ago. Importantly, 70% of small businesses do not know that the federal government already allows for flexible health coverage opportunities that could be beneficial to them and their employees. This includes choice arrangements and qualified small employer health reimbursement arrangements and the small business health care tax credit. Representative Tenney's proposal requires the Treasury Department to notify small businesses of these different tax advantage coverage options available to them. Giving employers more information about the health benefit options available to them will not only reduce the burden on small businesses, who are scrambling to keep the lights on, but will also give workers access to personalized health options that meet their needs. Thank you for allowing me to testify today, and I look forward to questions.
Thank you, Mr. Chairman. Chair now recognizes Chairwoman Virginia Fox for any comments she cares to make.
Thank you, Mr. Chairman, and thanks, Mr. McGovern, and all the members of the Rules Committee for inviting us here today. For decades, small businesses have expressed concerns about the burdensome cost of health care. This issue hits millions of American small business owners. That's why I'm pleased to see committee Republicans stepping up and spearheading solutions that bring down health care costs for job creators across the country, including 2 bills from the Education and Workforce Committee that are included in H.R. 3799. The first bill, the Self-Insurance Protection Act, ensures that small businesses have just as much opportunity to choose self-insurance as large businesses. Greater access to self-insurance is mutually beneficial for small businesses and employees. For employers, stop-loss insurance protects them from excessive risk and allows them to adopt self-funded health plans. Meanwhile, employees get to enjoy affordable and comprehensive coverage. Unfortunately, some states, like New York and Delaware, have banned the use of stop-loss for small business. What's worse, rising costs are forcing many small employers to drop coverage, leaving workers uninsured or forcing them to the Obamacare exchanges, where out-of-pocket costs are 3 times higher than employer-sponsored plans. Let me repeat that. In Obamacare exchanges, out-of-pocket costs are 3 times higher than employer-sponsored plans. The Self-Insurance Protection Act protects small businesses' access to stop-loss insurance and gives them a chance to fight the tides and continue to offer affordable coverage to their employees. The second bill, the Association Health Plans Act, also works to support employers and working Americans by allowing small businesses and self-employed individuals to join an association health plan, AHP. Allowing small businesses to pool their resources together would result in lower premiums and, in some cases, cut health costs by 50%. By giving individuals an alternative to the Obamacare marketplace, AHPs tackle a broader problem by lowering the cost of the United States' overall health care spending. The Obamacare exchanges are now more expensive than ever, and AHPs offer small businesses, self-employed individuals, and gig workers better, more affordable options. Since Obamacare went into effect, I've received many, many, many letters complaining about the cost and other negative aspects of the program. In contrast, among the hundreds of letters I've received on this issue, I do not remember ever getting a negative letter from an employee of a business which offers insurance. According to research from the NFIB, the cost of health insurance has remained a top concern for small businesses for over 3 decades. I'm confident that both bills I've outlined today will address this concern and bring needed relief to millions of employers and workers. Thank you, Mr. Chairman.
Thank you very much.
Should we talk about the other one? Would you like me to talk about HJRS 461 also now, or since
let's
we're dealing
hold
with
that.
health care?
Yeah, there'll be a second panel. We want
That's
to
what I
move
thought.
through this quickly so Chairman Smith can move on. And,
That's what I thought.
Thank you very much. So with that, let me turn to my very good friend, the ranking member of the Education Workforce Committee, Mr. Scott from Virginia.
Thank you, Mr. Chairman, Mr. McGovern, other members of the committee. I'm here to speak on the education and workforce provisions of H.R. 3799 and speak in opposition to the bill. This bill is yet another recycled, futile attempt to sabotage the Affordable Care Act and make it harder for workers and families to find affordable and high-quality health insurance. This legislative package includes 2 bills that were marked up in Education and Workforce Committee. First, the Association Health Plans Act, which undermines affordable care for working families. Association plans might lower premiums for some enrollees, but they do so by skimping on benefits and increasing costs for everybody else. And that's simple arithmetic. When you allow a low-cost group to come out of the pool, then everybody else in the pool will be paying more. These plans leave behind those who are more expensive to cover, like those with pre-existing conditions and older, sicker Americans, and break the core promise of the Affordable Care Act that everyone has access to affordable health care. Specifically, association health plans allow employers to cherry-pick low-risk young individuals for a separate pool than the ACA marketplace. This forces those left behind, on average, to pay more for coverage. Adding insult to injury, if somebody in an association gets sick and starts running up bills, they can leave the plan and return to the ACA marketplace and pay the average that everybody else is paying. And so it's simply unfair for everybody else who's paying higher prices due to the association plans, essentially serving as backup insurance for anybody that gets sick. Expanding association health plans does nothing to address the underlying driver of health care costs. In other words, the bill won't do anything to lower costs for workers and families. Instead, what it does, it favors the privileged few who can get into a plan with lower costs as opposed to those who are left behind. The second bill in the package is a self-insurance protection plan, a bill that also undermines the ACA by preventing critical consumer protections from being applied to stop-loss insurance. Now, when subject to appropriate guardrails and regulations, stop-loss can mitigate the risk for self-insured group health plans. But regrettably, stop-loss insurance is increasingly designed to mimic health care, but they're not obligated to follow any of the rules, regulations, or consumer protections that a health care plan would have. This bill would make it virtually impossible for the federal government or state governments to protect consumers from abusive practices. Most disturbingly, it takes an unprecedented step of invalidating state laws that are designed to protect consumers and also prohibit states from enacting similar laws in the future. Now, the full impact of that preemption is unclear, but it may call into question a state's ability to even apply basic solvency standards to stop-loss insurance. These proposals included in H.R. 3799 are dangerous for healthcare consumers, and by undermining the ACA, H.R. 3799 restricts access to essential protections that every individual deserves and ultimately will increase the cost for everybody that can't get into one of these plans. I therefore strongly urge opposition to this bill. Go back.
Thank you for your testimony. Chair has no questions for the panel at this point, but I'll recognize personal prerogative once again, advise the committee that our esteemed colleague, Mr. Norman, is celebrating his 40th birthday yet again and ought to be recognized. So. With that, I'll turn to my good friend, distinguished Vice Chair of the Committee, Mr. Burgess, or Dr. Burgess, for any questions he may have.
Thank you, Mr. Chairman. I'm actually pretty excited about what we're doing today. Association health plans, health reimbursement arrangements. These are some of the missing pieces of our healthcare system. Our late colleague, Sam Johnson, had the Association health plans legislation for years. And quite honestly, as I was a doctor in private practice for a number of years, it was hard trying to find group coverage for my small group because I was in the small group market. And the small group market could be difficult to navigate. But how much better would it have been had I been able to be part of a group such as my county medical society, American College of OB-GYNs, had I been able to take the membership of that group and purchase insurance in the group market, the large group market, like I don't know, any of your large communications companies that are known by their initials primarily. It would have allowed certainly a lowering of premiums. I disagree with the ranking member from Virginia. I do not think it was a method of, well, if anything, it was cost shifting away from those expensive plans that we were required to buy in the small group market. And I can think of any number of groups, certainly realtors who tend to work in an office where there's only 1 to 2 people. If they can put themselves together with all the realtors in a given area, say the North Texas area, or the state of North Carolina, then they could get the advantage of buying in the large group market that our large multi-state corporations enjoy. I think the ability to buy insurance in that market would be a meaningful improvement, not just for the business owner, but also for the employee who would subsequently be covered. So realtors, physicians' offices, chambers of commerce with 1 or 2 employees full-time, if they could band together and buy in the large group market, it would make a significant difference. I guess what I don't understand, Chairwoman Fox, is why it has taken so long to get here. And it took basically an executive order in the previous administration to actually begin this journey.
Well, I wish I knew the answer to your question about why it's taken so long. You're certainly right. I remember very fondly Sam Johnson. And we passed Association Healthcare Plan. This is what I've been told. I don't know if the story is true, but we passed it out of the 109th Congress, my first Congress here. And my understanding is that it went to the Senate and that it passed on a partisan basis out of the committee in the Senate, but that the Republican leader was reluctant to put it on the floor because it passed on only a partisan basis in the Senate. That's what I was told, and therefore it never came up for a vote in the Senate. Now, I've been on the off and on the Education Committee since that time, and I don't know how many times we've passed it out of the committee, many times. But it certainly is a bill that deserves to pass. All those folks out there who own small businesses ought to have this option. And it simply is not true that this insurance selects out people who are high-risk people. It does not do that. They have no ability to do that. They have to take everybody who would be in the pool. So as you described, all realtors, no matter what your health condition would be, if you're part of the program, you're in it. So it's very frustrating because I do think the public's been misled on what these plans do. So I guess the other side has a better messaging machine than we do.
Well, let me ask you this. What about the tax treatment of the premiums that are paid in the association health plan? Are those similar to the large group market?
As far as I know, but I don't know if
Oh, yeah,
the Chairman of Ways and Means.
we should ask the tax man who's here. let me rephrase that question to Chairman Smith.
If the tax structure in these is similar to, what was the question, Mr.?
The large group.
It's similar to the large group market.
Yes.
Well, and if indeed that is the case, I mean, that one of the biggest gripes I had as a small business owner was I got to pay for this insurance with after-tax dollars, whereas the big corporations that are in the large group market get the employer exclusion that is allows their dollars to go further because they're pre-tax dollars. And that is one of the great inequities of the system that I hope is corrected in this. On the issue of health reimbursement arrangements, Chairman Smith, Again, this is one of the programs that I've thought is, it's tailor-made for some situations. Now, let me see if I understand this correctly. When the Affordable Care Act was visited upon the Congress, and every member of Congress was made to take insurance in the Affordable Care Act, and then there was concern on the part of Harry Reid and President Obama and Speaker Boehner that there would be a brain drain in Congress and everyone would leave because the insurance was so crummy. But they'll make a special deal for members of Congress, and here is a tax-free subsidy that you can walk into the exchange as long as you buy your insurance, the DC Gold plan. So members of Congress basically have had a health reimbursement arrangement for over 10 years' time. So it seems like it's high time to make that same type of flexibility available to people in small businesses, where they would have a pre-tax subsidy available to walk into an exchange. And I think my friend Mr. Roy has mention of the health sharing ministries, which would also be a bonus. So is my understanding of that correct, that is similar to what members of Congress already enjoy?
Yes.
So why wouldn't we do that? Why the resistance when you had this markup in committee? Why the resistance to this if it's what's already being enjoyed by most members of Congress?
Yeah, it's hard to explain. One of the points that people tried to make in markup, and also the ranking member made up in his opening statement, is that this would deny protections of pre-existing conditions. And that's completely false. Under the choice arrangement plans, they must be ACA compliant. That's a requirement, meaning that these plans must cover pre-existing conditions. They must cap out-of-pocket expenses and guarantee issue during our enrollment, among other key health benefits. They have to be ACA compliant, so that has been their main argument in opposition, which isn't even accurate.
So, I had wondered about that, so I thank you for clarifying that. And Chairwoman Fox, if I could ask you, in the large group market, pre-existing conditions are covered. I mean, that was part of the agreement between Newt Gingrich and Bill Clinton back in 1996 with the passage of the Kennedy-Kassebaum Act. It way preceded the Affordable Care Act, but this goes back way into the mists of time. Pre-existing conditions have been covered in the large group market because of this, again, this agreement that was made between the Speaker of the House and the President of the United States at the time.
That's my understanding, and that would be true of these two.
Well, again, I thank you for bringing them to our attention today. Thank you for bringing them to the floor. I can't wait to vote in favor of the rule, and that will bring these up and vote in favor of the underlying legislation, because I just think it is so critically important to our constituents that they have this type of flexibility and this type of protection. Thank you, Mr. Chairman. I'll yield back.
Thank you, and the chair now turns to the distinguished ranking member for any questions he may have.
Well, thank you, Mr. Chairman, and let me also wish Mr. Norman a happy birthday. And my gift to you will be, I'll be fairly brief in my questioning. Dr. Burgess said it gives him a tremendous sense of excitement to bring these bills up. He and I obviously have a different definition of what excitement is, because this is not it, in my opinion. And I do want to say that the concern we have is that AHPs could vary premiums based on age or gender. It would not have to provide essential health benefits, which is very problematic to us. I was here when we debated the ACA, and basically it was over making sure people did have essential health benefits, including making sure people with pre-existing conditions were protected. But I just have one question to Chairman Smith. You know, it just seems I've heard my Republican friends talk a lot about cutting the deficit, about not adding to the deficit. But my understanding from CBO is that this bill would increase the deficit by over $300 million. And it is especially striking to me that the bill increases the deficit while, in my opinion, weakening people's health care protections. Have you seen the CBO score?
I believe that would probably be Representative Fox's question, because I think the score comes from Ed and Labor Committee.
Sorry,
Have you seen the CBO score?
I have not. I
Yeah,
apologize.
no, I will like to ask unanimous consent to insert in the record the CBO score, which basically says that this bill would increase the deficit by over $300 million. And I just find it
300
particularly.
what?
What?
300 what?
Million.
But there is a manager's amendment
Yeah, no,
ranking member that corrects
right,
that.
No, it doesn't. It does, according to this is CBO, this is, it says, let me read it to you here. Estimated direct spending and revenue effects of the Rules Committee print and the Choice Arrangement Act as amended by Amendment 8, which I assume is the manager's amendment. Yeah, it was 579 million. With your change, it's 300 million. Again, I pointed out because the deal that was struck only a few weeks ago, which punishes poor people, the whole fuss was over the deficit, and here we have, you know, a bill that, even with the fixes, adds $300 million to the deficit. I guess, yeah, you know, I just find that somewhat startling.
There's numerous pay-fors that I'd be happy to pay that $300 million with.
but
So
they're not-
I don't believe it should be. And I believe my
They're not
manager's
included in
amendment
this bill.
paid.
No, the manager's amendment does not, according to CBO, does not, it reduces it from what, 524? 579 million to 300 million. I mean, I guess 300 million is better than 579 million, but it's still $300
There's
million.
a lot of tax credits in the Inflation Reduction Act we could use to pay for that.
Yeah. Well, the bottom line is, in this bill, yeah, we have a disagreement with you on that, but nonetheless, they're not included in this bill. And the regulation that this, you know, and going back in response to Mr. Burgess, the regulation that this bill purports to codify discusses purchasing insurance that meets the ACA protections like essential benefits and lifetime limits or caps. This bill does not codify that element of the regulation. So a less consumer-friendly administration could undo those pieces in the future, and it is not correct to say that this bill codifies the ACA protections for these arrangements. Mr. Scott.
Yeah, a lot has been said about whether or not it protects people with pre-existing conditions. Technically, Dr. Burgess, it does. But you can price by past experience. If you got a lot of people with pre-existing conditions, the price is going to be higher than average. People are going to look at it and say, no, I'm going to stay in the ACA regular pool. That's why when you have an ACA plan, it'll always be cheaper, because if you randomly distribute the groups, some will be higher, some will be lower. Those that are going to charge higher than average will not be viable plans. Nobody will buy the product, only those with lower plans. And so you've gotten healthy people coming out. Now, there are a couple of things. So you technically have to, but the fact that you can screen, you can price by experience, means that those with pre-existing conditions never get into one of these things. The other is, if you got a bunch of realtors, all from the locality, and one of them has a child that's in the children's hospital, all their peers are going to say, come on, Mike, get back in the pool and don't hurt us. And so that's how the or if somebody with a pre-existing, a lot of expenses will be by peer pressure, jump back in the regular pool, so that the realtors or the physicians or the Chamber of Commerce plan will be much cheaper. So technically, yeah, you got to cover everybody with pre-existing conditions, but in practice, either you'll get priced out or you'll peer pressure, you won't join. But so that what you're going to have is a cheaper plan. You're going to have only healthier people, and what's left behind is going to be more expensive. And the more these things proliferate, unless you can get into one of these, the prices will go higher and higher. And we've been there because that's how it was before the ACA. If you had pre-existing condition, you couldn't buy insurance. Now you can, at the average rate.
And as I said, the way this bill is written, it could mean that a less consumer-friendly administration in the future could undo the pieces of the ACA that we think is so essential. But in any event, Mr. Chairman, I don't know if I ask unanimous consent to put the CBO estimate into the record.
Without objection.
And I just want to do that because I know my friends who are deficit hawks would want to have it in the record because that's what they claim is so incredibly important. But I want to put in the record, and out of respect for Mr. Norman's birthday, I will ask no further questions. You're back.
Thank my friend. We now turn to the gentleman from Pennsylvania for any questions he may have.
Thank you, Mr. Chairman. I appreciate it. And I know Mr. Norman's getting a lot of attention today, but it was Mr. Smith's birthday on Friday, so I want to acknowledge his birthday. And you're welcome. And thank all the witnesses for coming in. And with that, I yield back, Mr. Chairman.
Thank you. Gentlelady from Pennsylvania is recognized for any questions she may have.
Thank you. And if we're celebrating holidays, yesterday was Juneteenth, and we had a number of very vibrant celebrations in my district, which were really wonderful educational and cultural opportunities for our entire country. I am concerned about the Choice Act and its codification of a Trump-era rule that really allows employers to offer a capped amount of money towards healthcare costs to certain classes of employees. It appears to be yet another attempt to circumvent the ACA's protections on pre-existing conditions, lifetime and annual limits, and preventative care. Does this fit the pattern, Mr. Scott, of a death by 1,000 cuts to the ACA without any replacement plan?
It does, and the basic promise of the ACA is that everybody can get affordable coverage because everybody's paying average. If you've got a pre-existing condition, you pay average. If you don't have a pre-existing condition, you pay average. And once you allow people that are young and healthy to pull out, those left behind, just simple arithmetic, will end up paying more. And the more healthy people you pull out, the more expensive it gets for everybody else. And we know what that looks like because that was what it was before the Affordable Care Act. If you had a pre-existing condition, if you could get insurance, you paid a lot. It's almost unaffordable. And that's what we would be getting. And like I said, if you have an association plan, it'll always be cheaper because if the analysis is that it's going to be higher than average, nobody's going to buy it.
And I share the ranking member's concern that it provides less robust, less complete health care coverage and does so at a cost to the federal government, with the CBO score, even as amended, being almost $300 million. So not a big fan of this one. Thank you. I yield back.
Thank you. Gentlelady from Minnesota is recognized for any questions she may have.
Thank you, Mr. Chair. And I just kind of want to bring it back to, and maybe Chairman Smith could just answer a couple of questions. You know, isn't it good to help people afford the kind of health care insurance they want or need or fits their needs? Isn't that a good thing?
Absolutely.
Yeah.
The patient should have more options and more choices instead of the government telling them what they have to have.
Yeah, and that's what we're doing here. We are trying to make sure that people do have affordable health insurance, and you do that in a variety of ways so that people can find what fits their needs and their lifestyle and their financial ability. And I just wanted you to repeat, you mentioned in your opening the statistics about how many of the small businesses and how many people have health insurance, and I just wanted you to repeat that because I think that's an important thing that we're dealing with.
Yeah, if you look at right now, in small businesses, currently only 30% provide health insurance. 20 years ago, 50% provided employee health insurance. So we're definitely trending in the wrong direction, and giving more options and opportunities is extremely important. We've been doing these field hearings all over the country, And one that jumps to mind, which you were actually in attendance in Petersburg, West Virginia, was a restaurant owner named Ashley Bachman. And she pointed out that how difficult it is to just hire employees. And a big consideration is being able to provide healthcare and options to healthcare. And this is another aspect that creates an options for employers, can hopefully attract more employees to help lift more people out of poverty and have healthcare coverage while they're doing that.
And Chairman Smith, as I recall, it was options and affordability were the big things that we heard about. So that's why small businesses aren't, because it is so just outrageously expensive when they don't have the flexibility to look for something that fits, their financial ability and their patients, and their employees. I won't ask a lot of questions because I think that we understand the need for this flexibility. But I just want to say that, as we hear about, Chairman Scott had mentioned something to the effect of that. If you're in an association and you have high bills, there's going to be peer pressure to get out. I don't necessarily think that's accurate because I don't even know if people would find out who has the bills and things like that. I've heard of association groups that, and nobody, when someone has high bills, they are not pressured to get out of a people, I think, see the reason that they're there is that is an actuarial issue, and they pay for it, and those kinds of things happen. But I don't see peer pressure because I think there's all kinds of laws that would prevent them from pointing to somebody and saying they're costing more money. And so I think that's a little far-fetched, and I think the association...
If it's a small...
Ma'am, or excuse me, sir, do you want me to yield? Would you want to ask me to yield? Or are you
Will the
just
young
gonna
lady
interrupt?
yield?
Yes, for a moment.
Okay, yeah, if it's a small group, everybody knows whose child is in the children's hospital, running up thousands of dollars a day, and then when the bill comes for the premium renewal, everybody gets shocked.
But sir, I've never heard of someone going to people and saying you have to get out of our plan. And I don't know if Chairman Fox, you seemed like you wanted to say something, but I've just never heard of that.
If the gentlewoman would yield, it seems to me that the whole idea, particularly behind association health plans, is you're making the group as large as you could possibly make it.
Yes.
So that is not going to happen. And I think what we hear from the ranking member and what we hear from Democrats all the time is this may happen, this may happen, this may happen. Boogeymen are thrown up all the time to say why we shouldn't do something. And I agree with you. I just don't think that's going to be a problem.
And I think I've seen great success with some of the association, the ability of those associations to come together because it does help the small businesses in that. But I guess I will just wrap up by saying this. I think that it is a positive thing to provide more flexibility, more options, because we do want people covered by health insurance, and if this way will help people afford it, help them have the kind of health insurance that they'd like, then we need to be doing that and providing people with more options, not less. And with that, I yield back. Oh, I don't yet, Mr. Chair. I yield to Dr. Burgess.
So I just want to point out on the CBO report that's gotten so much attention, it does address that issue of the increased coverage numbers, and that is important. And they actually estimate that 40,000 people a year who are currently uninsured will now have insurance because of the efforts you're undertaking. So for that, I thank you as well, and I'll yield back to the gentlelady.
And I yield back, Mr. Chair.
Thank you very much. Gentlelady from New Mexico is recognized for any questions she may have for the panel.
Thank you very much, Chairman. It just strikes me as, I'm flying in and looking at the materials and thinking what the last many years have been like, that basically Americans want to be able to have affordable, accessible health care. And they want to make sure that health bills to pay for the health care they need doesn't bankrupt them. And that what the Affordable Care Act did, and what we did last year in the American Rescue Plan and the Inflation Reduction Act, was making sure that healthcare was more affordable so that we could make sure we grew the middle class. And they did not have to worry about bills for healthcare that would bankrupt them. And we were able to do that because we had guardrails, because we had protections to make sure that when you got pregnant, when you had a very serious illness, when you had cancer, that you were not then bankrupted for the care that you got. And that, as the ranking member pointed out, that the pool was large enough to make sure that the risks were spread out. And, you know, it worked. In 2022, the uninsured rate stood at 8%, the lowest level in history. Finally, 92% of Americans now have access to health insurance and health care. In fact, following the American Rescue Plan, 16.3 million people signed up for coverage through healthcare.gov. What we did was save $800 per year in premiums. So what Americans want is for us to keep moving in that direction, and what we see instead coming out of these Republican bills is an attempt to go backwards, to make it harder for families to afford health care. Ranking Member Scott, we've heard that association health plans won't be able to set premiums based on health, but could they use age and gender as a basis?
Well, they would get priced by, you could be priced by experience. So if the association is running up higher bills, they would have to pay higher premiums.
So if they were older, if you had a workforce that is older, if you had a workforce that had more women in it, would you likely be paying a higher price?
And sicker, yes, you'd be paying a higher price. And this doesn't reduce overall healthcare costs. You've just shifted the cost into an association. The association will always have below average costs because the consumer will look, I can join the association, oh, wait a minute, their costs are higher than the Affordable Care Act premiums. I'm not moving. So you won't buy the higher premium association. So some associations will have a high price, some a low price. The high price won't be viable. So yeah, every association will have a lower than average price. And it's simple arithmetic. Everybody left behind will be paying, on average, more. And so the more associations you get coming out paying lower prices, the higher everybody else. And if you got a pre-existing condition or you're in a group with people with pre-existing conditions, you'll never be able to get an association. So you're just stuck with a gradually increasing premium. All the healthy people over here are getting lower premiums, and you know what that looks like because it looked like that before the Affordable Care Act. People with pre-existing conditions couldn't afford insurance.
So, Chairwoman Fox, the new association health plans would, under the AHPA that's presented here, would not be required to cover maternity or prenatal care. Is that correct?
Say again, I'm sorry.
They would not be required to cover maternity or prenatal care.
No essential benefits.
No essential benefits.
There
That
are-
was a question for the chair, but thank you for answering it. And ranking member, was there an amendment in Ed and Workforce to make sure that maternity and prenatal care would be covered? Ranking member Scott?
Say again.
I recall there was actually an amendment because people are worried, women are worried that we want to make sure prenatal care is covered. I mean, I gave birth to 3 babies and I had many other pregnancies. It's dangerous.
And if maternal coverage is not provided in the association, then disproportionately those costs are borne by those left behind.
So what strikes me on
Mr.
this
Scott,
bill...
could I ask you a question? Would you yield a second? What
Yes.
do you mean by those left behind? Who are those people? Because you've referred to those people. If they're not in association health plans, they're people left behind. Who are they?
They're the people who are buying insurance on the marketplace.
Okay, well, that doesn't make sense to me. But what you're saying is, if they're not in association,
Right.
health plans, they can get lower prices
in the
association
that's right.
health.
That's right. You're right.
Okay, but if they're eligible to join the association because they're in a certain category, why would they be left behind? That's what I don't
No,
understand.
the people who join the association will enjoy lower health care costs. Everybody else that they just left will be on average paying more. The health care costs didn't go down. This is simple arithmetic. If you have a group of people with insurance.
Then, of course, they could go into the ACA, of course, right?
That's where
If it's a better deal for them, then they could go in the ACA. So nobody has to be left behind in our culture.
I shall,
No. We don't have association plans now. If you have everybody in the Affordable Care Act, if only healthy people can join the associations, because sick people will get priced out and they won't join.
Mr. Scott, that is simply not true. And I think we have to say it over and over
Okay,
and over again.
this is arithmetic.
so the Affordable Care Act was carefully crafted to make sure that everybody would be included, that there would be guardrails that would cover things like maternity care, things like addiction and behavioral health, especially now that we're facing all of that. And what we see with AHPs, it is not covering those. It is not required. And so instead of addressing some of the major healthcare issues, we are not addressing them in the AHP because we're leaving those out. Then we are like discriminating in essence within the health insurance
And
plans.
maternity care is very expensive.
Right.
And if you can have a plan that doesn't cover maternity care, you can save money. But we have, under the Affordable Care Act, everybody pays average. You lump everybody's costs together and everybody pays average. Now, if you want to pick and choose, the maternity care is very expensive, and if I can get a plan without maternity, I can save some money. But everybody else who is left behind will be paying more.
So basically,
arithmetic.
Right, it's simply arithmetic, but the focus on women right here, right? Because we are seeing across the country and even in this Congress that Republicans want to ban women from getting reproductive health care, but they won't require that all insurance plans, including AHPs, cover maternity care. That's the disconnect here, and that's what I think we are seeing is this is simply wrong. With that, Mr. Chairman, with the outrage about this disconnect and mistreatment of women, even though it is more expensive to treat us, we should be treated for all of the care we need. With that, Mr. Chair, I yield back.
Thank you very much. Gentleman from Kentucky is recognized for any questions he may have.
Thank you, Mr. Chairman. I just want to yield time to Chairwoman Fox if she had some additional comments.
I do, Mr. Chairman, and I thank the gentleman from Kentucky. Number one, AHPs would be treated exactly as employer-sponsored plans. So if they choose to do maternity and newborn care, they can do that. And again, our colleagues are saying, if, may, as though things would be that way. But it's going to be up to the AHPs, but they operate in exactly the same way as employer-sponsored healthcare does. The other comment I want to make, and it just absolutely drives me insane, when somebody says that a benefit to the citizens is a cost to the federal government. Less money coming into the federal government is considered by our friends on the other side of the aisle as a cost to the federal government, as though everything we earn belongs to the federal government. So the $300 million that you're talking about, as Mr. Burgess rightfully pointed out, means more people are going to be covered, which means less money going to the federal government to pay the subsidies for Obamacare. But meanwhile, people get choices. And so it's all to the benefit of the citizen. It's less control by the federal government, less money going to the federal government, and that's good. So I think it's important that we point that out. And let me say, under essential health benefits, which we talked about a lot when Obamacare was covered, and we've talked about a lot in other things. You may have a business that is all single men, and they want to have health insurance, but they're being forced in many cases to do maternity and newborn care and pediatric care, but they don't need that. And so, again, under choices that you're giving people, you're saying you don't have to pay for all of these benefits which the government deems are essential. That's probably all that I need to say before I get in trouble saying something else.
Well, I'll give you as much time as it takes to get in trouble. Chairman Smith, would you have any comments that haven't been addressed?
I think Chairwoman Fox did a great job.
I would just say that, there are people who are hard workers and they have no employers. There are hundreds of thousands of farmers. And they are excluded from these wonderful employee plans that for people who have bosses. Now, a lot of people farm because they don't want a boss, but and they're providing a service for society, but these association plans would allow them, I believe, to have the same benefit or access to benefits that people who work for corporations have. And this was a problem before Obamacare. It's a problem after Obamacare. I would just say that one of the biggest untold failures of Obamacare has been COVID. You didn't have much choice in COVID for the kind of treatment you were going to get. The government told the hospitals what they could do and what they couldn't do, and that's what you got. And I think that was a failure. But I'll yield to my good colleague.
Thank you so much.
Legend
Kentuckians are always so kind.
Yes.
So
Don't abuse us for that.
So I think that there was a really important sentence that the chairwoman pointed out, which is if they choose to offer maternity care. And that is, I think, what our problem with it is we don't want employers, we don't want AHPs to say, we're going to choose not to offer maternity care. That was the idea of offering some basic sets of key pieces of healthcare that we need in this country. And so I think that I appreciated your answer, Chairwoman, because I think that highlighted the distinction. Thank you very much for allowing me to
Would you
yield.
indulge me for a question? Would you support this if they were required to offer?
I think one of the ways in which we could improve this, and we offered an amendment and ed, House Ed and Workforce, and every single Republican voted against the amendment to require that maternity care be offered. So it would have, it would be a different bill, but the Republicans in House Education and Workforce chose to reject that amendment.
Maybe we can fix that when this gets to the Senate.
I stand corrected. The Association of Health Plans do cover maternity and child care.
I thought they might. That's why I was asking if she would support the bill where they were required to. One of the reasons. Do they or don't? Do they or don't they? They may. Okay. Not shall. Okay. Thank you very much. And
Yeah, I think that's the issue of may versus you are required
Understood.
to. It's the optional choice.
I'll yield back.
Thank you. Gentleman from Texas is recognized for whatever questions he has for the panel.
No, one more clarification. They are required to cover childbirth and newborn. So we'll get rid of that myth.
Wait a minute, say that again. The association plans?
Let me just read it.
So on my time,
Gentlemen,
I will yield to
recognized.
the chair lady to fill in this gap.
Association health plans provide both maternity and newborn benefits. For large group association health plans, Title VII, the Civil Rights Act requires the plans to cover pregnancy, childbirth, and related conditions in the same manner as they cover other medical conditions under the association health plans.
Would you mind providing us the section in the law that provides that?
Oh, we had an amendment.
Gentleman from Texas controls the time.
I thank the chairman. I was trying to provide some flexibility to kind of bring that matter to a conclusion. The question I would ask, though, Chairman Fox or Chairman Smith is, okay, if that is true, or whether there is a requirement that there is that coverage or not, does that increase the cost for the businesses in question? Would the increased coverage requirements, whatever they may be, likely increase the cost of the health insurance coverage for a business, whether it's a large corporation, you know, those grand corporatists in Orlando at Walt Disney, or anybody else, if they're providing insurance, if they provide greater coverages, whether it's required by law or whether it's by choice, does it cost more?
Generally, I would say yes.
Right. So therein lies the whole question that we're talking about. And thus it has always been, is who pays? That has always been the fundamental question, is who pays? And then what are we doing to overall prices, the overall price of care and the quality of care when we make choices about how that care is administered? That's it. That's the whole thing. And we go around like championing one thing or the other in some big, you know, speech for politics about we will cover maternity care, we will cover this, we will cover that, and pre-existing conditions. And all you're doing is blowing the lid off of costs. That's what you're doing. By definition, as has borne out, that's what you're doing. And in the process, by the way, enriching large corporations massively. And of course, their investors, whomever they may be. There are a couple of data points out there. I wonder if either of the two chairmen or the ranking member would like to comment. According to the Bureau of Labor and Statistics, medical and health service managers, which are described as managers that, quote, plan, direct, and coordinate the business activities of healthcare providers, otherwise known as bureaucrats, are slated to see a 32% growth in jobs from 2019 to 2029. This is compared to a 4% growth for physicians and surgeons. Health insurance companies take in about $1 trillion per year. Health insurance companies. Health and medical insurance companies place second in biggest industries by revenue in the United States, only behind retirement and pension plans, by the way. The deals they strike with the government, most notably and most recently, the massive deal struck under Obamacare, guarantees that success and growth rate. For example, Anthem had a 344% increase in government revenue from 2010 to 2020. United Healthcare had a 198% increase in government revenue. Cigna, Anthem, United Healthcare, and Humana have seen an average increase of 562% in their stock price from January 11 to January 21. Additionally, in 2016, 60% of the nation's top 5 health insurers' revenue, $213 billion, came from Medicare and Medicaid, up from $92 billion in 2010. In 2018, for at least 3 of these companies, the majority of their revenue, I want to state that again, the majority of their revenue comes from the government. United Health, 53%, Anthem, 58%, and Humana, a whopping 86.9% of the revenue comes from the government. Small businesses cannot break into the big insurance market because they are small. And my Democrat colleagues want them to be left with no options whatsoever. So we slide closer for Medicare for all. That is precisely what my Democratic colleagues want. Precisely what they actually campaign upon. And in my experience, when somebody tells you something, you should believe them. That's the truth. The exceptions that Republicans are putting forward at the moment, modest, with all due respect to my colleagues, these are crumbs. These are crumbs from the table. Important ones, I support them. But it's like taking Dixie cups of water and throwing it onto a massive fire and pretending that you're leaving something behind that's going to save the house. But you're not. Because all we're doing is continuing to fuel the corporate crony insurance-run healthcare that's not really care. It's corporate crony insurance-run health management that is destroying the ability of individual doctors to provide care, the ability of individual people to get care, and driving up the costs. And here we have the complaint that this would cost, according to scoring, in this world in which we operate in D.C., where scoring is how we decide policy. And the complaint is it would cost $300 million. I don't know if that's a 10-year budget window or 5-year. I don't know. Somebody can fill me in on what it is on the window for the $300 million net. And I remember I heard the Chairman Smith, say, well, we could pay for that. Well, of course we could pay for that. We literally have $22 billion just sitting over the Department of Commerce after the debt deal, just sitting there, ready to be used for whatever you want to go spend some of this magic money on. So you can pay for this if you want to. The question isn't that. The question isn't whether or not you're going to say, wait a second, we're going to pull people out or allow them the option to get out of this and say, I want to go provide this other solution, this business. I want to go provide this other solution. So healthy people, allegedly, could be a large number of people, but want to go into that solution. And that allegedly pulls certain people out of the pool and drives the cost up. Well, that kind of gives up the game, doesn't it? I mean, that's the whole point. My friend from Virginia is talking about, well, we're averaging the cost. Those are the terms we use in the swamp, right? We're averaging the cost. Well, what does that really mean? That really means we're saying you American, you have to pay X for whatever we allow you to have, we the government, through our wisdom, this is what you're allowed to have. And as a result of that, you'll be a part of this pool, whether you like it or not, so that we can, quote, spread those costs out so that we can provide, quote, unquote, coverage. That's what that whole convoluted scheme is. But in fact, when I came to Washington, I was put on Obamacare. I was put on Obamacare because, we don't have those gold-plated plans that everybody always says we have out on the Twitterverse, right? What we have is Obamacare, which is far from gold-plated health care, let me assure you. Because coverage isn't actually care. The fact is, at least the last time I checked, these things can change. The last time I checked, if I were on the Obamacare plan that I would have through my job as a member of the United States Congress, I wouldn't be able to go to MD Anderson, which was the cancer center in Texas that I went to in order to combat cancer in 2011. Now, in what universe is that care? It's not. We go around patting ourselves on the back because we throw people into coverages and we expand Medicaid massively to the tune of the 22 million people that we allegedly expanded coverage to. 11 million of those were put on Medicaid. Hardly something people run around saying, well, that's a better solution because you ignore the 6 million that got taken off of their private insurance plans after Obamacare was put into place. Now, we can go around this barn 100 times, and everybody goes around talking about, pre-existing conditions, and, they like to thump their chest about what all is, the greatness of Obamacare. But the fact is we have a massively broken system that is enriching a small cadre of folks and corporations to run insurance-run health management rather than care. I would throw to both of the chairs of the two committees here, do you agree with that sentiment? And it is not the whole point of these bills to provide greater options, to provide more affordable options for small businesses, to be able to allow more Americans to be able to access options in the healthcare system rather than being pigeonholed into very tight, fewer options from a government-run system or government-controlled options?
It absolutely, Mr. Roy, provides more options. On point that you hit on earlier, the expanded Obamacare subsidies that was passed by Democrats just recently, that money flowed directly to those large health insurers, what you were talking about.
Right.
What's different is the choice arrangements that we have here allow small businesses to reimburse their employees directly. So those employees can go purchase what option of health insurance we want. So we're doing the complete opposite. We're not allowing those big health insurers to have all the money directly from government. We're giving it to the individual so they can pick the plan that best fits their healthcare needs.
Ms. Fox?
Yeah, and I think to summarize what Mr. Smith just said and what you were saying is it all boils down again to whether the government's going to be in control or you're going to have the individual in control. And that the Democrats always go to government control. Let me give you a couple of additional facts. For employer-sponsored plans have lower average deductibles, $1,763 for an individual ESI plan compared to $5,155 for an individual ACA plan. In addition, they have lower average out-of-pocket cost, $4,355 average maximum for an individual ESI plan compared with $8,519 average maximum for an individual marketplace. So what you're saying, Mr. Roy, everybody's paying for these government plans and what the chairman was saying about the average cost. You're right. It's cost sharing, okay, but for all of us who are not on those plans, we're helping to pay. It shows employer-sponsored plans are a much better bargain than the ACA in every way that you cut it, every way that you cover it. And by creating more choices, you're going to lower those costs even further because you're going to be able to open this up to the farmers Mr. Massey's talking about, the small business owners. So you're going to get people off of Obamacare, hopefully, onto these, and it would be a lot better for them. Well, and the comments you made about all this money going into the large insurers, it's just an abomination. It's just an abomination.
Well, thank you, Chairwoman Fox, and I will be mindful of time. And a couple points. A 2019 study found that only 31% of Americans were able to correctly answer this question. Suppose that under your health insurance policy, hospital expenses are subject to a $1,000 deductible and a $250 per day copay. You get sick and are hospitalized for 4 days, and the bill comes to $6,000. How much of that hospital bill will you have to pay yourself? Most people don't know, and they don't understand the complexities of the system that we've structured. Now, that is an indictment of the entire system. It's not an indictment of Obamacare. It's not an indictment of any of the alphabet soups per se, right? It is an indictment of a complex system that we've allowed to get more complex. The point I will simply make, I offered 3 amendments. One is a resolution that I believe will be made in order. I think there are 2 others that are still being debated about whether they'll be made in order because of the same question that is we're debating about the underlying bill about cost, right? And whether there'll be a waiver or whether or not there's an amendment that I might be making in order because we're able to pay for it. But I had 2 amendments. One would allow healthcare sharing ministries to be reimbursed through an HRA. Healthcare sharing ministries are being used by hundreds of thousands, millions perhaps of Americans as a way to be able to provide affordable care that gives them options to be able to access the doctor and the care of their choosing. And we ought to be making it easier for them, not harder. And that is one of the points that we're trying to address here. So I'd offer an amendment that would have been able to do that. The second amendment would allow direct medical care to be reimbursed through an HRA, the ability to go directly to a direct primary care provider. There are thousands of those that have sprung up around the country as alternatives to the insurance and hospital-run health, quote, care. It's not really health care, let's be clear, that we currently have that's breaking the back of everybody. In July of 2022, last year, Amazon purchased the direct primary care company, One Medical, for almost $4 billion. Now, that is in part because that alternative was providing an option for people. But it is an option that is severely constrained by the massive limitations put on it by Obamacare and the ACA, and that we're trying to free up. Now, the 2 amendments that I've offered probably would score. Yes, because of the same reason we're talking about it, the underlying bill would score. But the very score basically gives up the game. It explains why this whole system is convoluted. So I would suggest that these amendments should be made in order, that if these things cost, be happy to go figure out how to find a way to make them pass budget muster and the points of order. Because like right now, we have hundreds of billions of dollars, probably trillions actually, that are floating out there on the back of massive policies that my colleagues on the other side of the aisle put forward, whether it was the transportation bill, whether it was an IIJA, whether it was the Inflation Reduction Act, which Goldman Sachs says it costs $1.2 trillion, Or even, as I said, the modest $22 billion sitting in an account at the Department of Commerce now that is basically funny money for Washington to go play with. Well, why don't we go play with that funny money to free this up for the American people to be able to use it for health care? I yield back.
Gentleman from South Carolina is recognized for any questions he may have.
Thank you, Mr. Chairman. Let me just say that I run a small business. Healthcare is one of our major costs. I say small, 20 people. Having options is what the American system is all about. One size does not fit all. Y'all mentioned my birthday. I don't need maternity care anymore. We don't need the coverage. I ought to be able to pick what I need. And that, along with the fact, and Texas has done a good job of this, tort reform is needed now more than ever. I can't tell you, and Dr. Burgess, you know this, the doctors that practice medicine who are defensive medicine, they're spending our dollars, their time, trying to avoid a lawsuit. And God help you if you're an OBGYN and come out with a bad outcome, or really any other physician that has a bad outcome with a patient, which is going to happen. So I do like these amendments. I think it's the first step. It makes sense, and we'll support it. Thank each one of you for being with us today. I yield back.
Thank you. Gentlelady from Indiana is recognized for any questions she may have.
Thank you, Mr. Chairman. Apologies, I've lost my voice. Thank you to the witnesses for testifying before us today. I appreciate your time. So our Democrat colleagues like to categorize the association health plans as junk insurance. They say these plans allow cherry picking and discriminate against people with pre-existing conditions. In reality, association health plans are anything but junk plans. They're a great option for all Americans regardless of health status. As a former small business owner, I certainly would have appreciated the opportunity to have the choice that association health plans can offer. And Dr. Fox, as you stated just a moment ago, employer-sponsored insurance on average provides richer and more robust coverage than plans on the Obamacare marketplace, and the majority of Americans are satisfied with their employer-sponsored plans. The Association Health Plans Act, which is part of the Choice Arrangement Act, would allow more small employers and self-employed individuals to band together to create an association health plan. Chairwoman Fox, does this bill allow for association health plans to cherry pick which employees can participate?
Thank you very much for that question. Absolutely not. We need to say it over and over and over again. Association Health Plans Act explicitly prohibits AHPs from discriminating based on an individual's health status and does not allow them to raise premiums, rescind coverage, or create waiting periods for people with pre-existing conditions. And by the way, I need to say something about pre-existing conditions aside from your question. It was mentioned earlier that we didn't have coverage for pre-existing conditions in this country before, but I remember the debate on Obamacare. My recollection is we had 27 states that had pools for pre-existing conditions, and North Carolina was one of those states, and the average cost for premiums for the people in pre-existing condition pool was lower than for other plans. So if there were states that didn't have pools for pre-existing conditions, then they should have done it. The poor excuse for Obamacare was that it was going to cover all pre-existing conditions as though none were covered before was just not true. And let me come back now to the AHPs. They cannot charge individual employees different premiums based on their health status. They're treated just like large employers. The premium is based on the risk profile of the AHP, just like large employers. And then the premiums can vary based on the risk profile of the individual company. So it is not true that the association health plans discriminate on the basis of one's health status. We can't say that often enough.
And Chairwoman Fox, does this bill discriminate against poorer or low-income employees?
No.
The self-insured market allows employers to have more control over plan benefit design and lower out-of-pocket costs for their employees. It's certainly a concept that I support. I continue to be dismayed by our colleagues on the other side of the aisle and the viewpoint that seems to consistently come out that government always knows best. Dr. Fox, you aptly stated it always seems to come back to government control versus individual control or freedom of choice. I believe adding choice to the market is a good thing. I certainly prefer competition in the marketplace over bureaucratic government monopolies. Thank you for this legislation. Mr. Chairman, I yield back.
Thank you very much. I assume there's no further questions on H.R. 3799. Given that, Mr. Smith, Chairman Smith, you are excused. I'd like to welcome our second panel. It bears a lot of similarities to our first panel. So I'd like to welcome Chair